What was nurses training like?
Oh, I think I mentioned something about that. When we first went into training, first 6 months, you're a probie. You have a different cap, and you wear black shoes and stockings. And we wore black shoes and stockings, and so, we weren't very happy with that. And the thing was, it was during the war. See, I graduated in 1938 to 41. The war started in 41. And we were getting our black dye from Germany. And of course that cut off then. We didn't get that. We had our own black dye. And so I had black shoes and stockings. And somehow the dye, I must have rubbed a little skin off on my leg. I think it was the left leg. And I got a cellulitis. Then I had a black or a red streak all the way up my leg to my groin. And the glands in my groin were like little peanuts. They were so hard and inflamed. And of all things, they called a lot of the interns. They went into the emergency room. That's where you sign in when you, as a student nurse, if you're sick. And they called in the interns to come to the emergency room because they wanted them all. They were learning a classic case of cellulitis. And I was so embarrassed because, of course, they feel up in here, in your groin, and I'll never forget that. I think, oh my golly, what in the world? I should have just struggled on, but it's a good thing I didn't, because it could have gone into blood poisoning. Back in those days, they didn't have anything for blood poisoning. That's when I got my ear infection. I was in bed for, I missed 2 or 3 weeks because it was in my ear, and they only had sulfanilamide to give me. And my sister came up to see me, because she was in training too. She went into nurses training, and she said I didn't even talk to her, and I don't even remember her of coming up to see me. In fact, she said that the nursing instructor, or our chief, her name was Miss McDonald, had told my sister that they was afraid they were going to lose me, that I was that sick.
Was that with the ear infection or with the cellulitis?
It was the ear infection, yeah.
So the cellulitis happened earlier?
Earlier, yeah. And
the ear infection happened later?
Later, yeah. The ear infection happened when I was in pediatrics, and I caught it. Children have a lot of bugs.
Mm-hmm.
I was in pediatrics, and that's when I got the ear infection. And I had a sore throat, and it went into my ear, and that's when the head of nursing told my sister that they were afraid they were going to lose me, because before I came into training, they had lost a student nurse. She cut her finger on a tonsil wire. You know how they take your tonsils out? They take the wire and squeeze it off. And she cut her finger, and she died of septicemia, or blood poisoning, yeah.
Did they do something particular to heal your ear? Did they puncture your eardrum?
No, but I was laid up for, that's how I missed 3 weeks of training. I missed 3 weeks because the doctor would not let me out of the infirmary until there wasn't one speck of drainage, it was my left ear, on that cotton that he would put in there every day. He'd come and clean it out and put a clean piece of cotton. And if that cotton wasn't perfectly clean, I wouldn't get out. I'd have to stay in until that piece of cotton, and so that's why I guess because they had lost that other student nurse, and see, we didn't have anything for those days for like sulfanilamide, and well, we did have sulfanilamide, but oh, it made me so sick. Just about the time they'd come in with I'd be feeling pretty good, and then and then they bring in another dose. So every 12, 4, 8, and 12, yeah. And so.
Anna asked what the first 6 months were like. I mean, how did you feel when you went to nurses training, or was it easy or hard? What the question Anna asked was, what were the first 6 months were like?
Yeah, well, it wasn't too bad. We were probies, and I said we had black shoes and stockings and different caps. And when you were a senior nurse, then when you got to be seniors, you got to get white cuffs that you'd pull on over your blue uniform. We had blue uniforms. And then you'd put these white cuffs and came up to here. And that was a real sign of respect, you know, for the underclassmen. They had to respect us senior nurses. And so, yeah, my mother said that when I was 7 years old, I'd said I was going to be a nurse. A nurse, yeah. And I don't recall of ever the instant thing, oh, that's what I want to do. But I remember going to St. Francis Hospital to visit, when my mother would go up there to visit. And I was sort of, I guess, thought it was kind of nice to be a nurse, running around. And our nurses' caps were organdy, little organdy pots. You just sit on the back of your head. We had to make them. And we had to make clean ones. We were down by the Illinois Central Railroad, and the air was so dirty, shall we say, that those organdy hats would actually get gray after 2 weeks. After wearing them for 2 weeks, they would get gray. And we have to make a new one. We have to get, in fact, I've got some material in my bottom drawer in the dresser in there that I could make another cap if I wanted to. It was kind of tricky. They had little pleats, little pleats all around it. And so that, yeah, my mother went with me when I went down to Chicago, and got me started. I didn't, just go on the train all by myself. So, yeah, well, I guess that about sums up how I felt about nurses training. I really was happy to be in it. It was hard, though. The subjects were so different. They were about medicine and I'll tell you another thing. I was looking through my anatomy book, and I was sort of looking just at the top pages, and it had at the top something about union. I can't remember now just what it was at the very top of the page. Others have the subject matter, and just to show you how dumb I was, I thought, what in the world are they discussing trade unions for in an anatomy book? And that's I had no idea what the subject matters were in that anatomy book. And there were other things that I just was real stupid. My mother never told me anything. I didn't even know where babies came from. And I think that for girls 6, there was one girl in our neighborhood who lived across the street, and her name was Beatrice Morton. And she said that she knew where babies came from, but she wouldn't tell any of us other girls. That's how kind of dumb we were. And not dumb, but just uninformed, shall we? That's a better word, yeah.